So we need to talk. We need to talk about something that most people do, but almost no one talks about: how you're masturbating. Because believe it or not, there are some good techniques, and then there are some questionable ones. There are some techniques that might be ruining your pleasure or your sex life. Hello, everyone. It is Dr. Fenwa Milhouse, board certified urologist, your favorite urologist, the doctor down below from TLC, right here. Every year, I see a few patients that come into my office with some sort of genital injury as a result of unfortunate masturbation debacle. And so doing my due diligence as your down there expert and spending time in this video, making sure we all know some good masturbation techniques. At the end of the day, I am pro self-love. I am pro body exploration. I am pro utilizing toys, and I do not kink shame, but we just need to make sure that we are doing it safely so that you don't have to come see me for that reason. All right, let's get into it. So we need to talk. We need to talk about something that most people do, but almost no one talks about: how you're masturbating. Because believe it or not, there are some good techniques, and then there are some questionable ones. There are some techniques that might be ruining your pleasure or your sex life. Your hands could be the hero or could be the villain of your own orgasm story. But I got you. Don't worry. Let's get into it. First off, masturbation is normal, healthy, and can actually improve sexual function. But the way you do it, that kind of matters. The people who masturbate regularly in healthy ways tend to have better sexual function, not worse. But poor technique might lead to things like chafing or other genital injuries. It might lead to occasionally performance issues during partnered sex. So we're going to talk about how we can avoid these two things from happening as a result of masturbating. Let's talk about some bad masturbation techniques. Number one, this infamous death grip. This is not a scientific term. It refers to the use of a super tight, fast, super aggressive pressure to masturbate. Okay, sure, it might feel super intense in the moment, feel really great, but over time, it can make achieving climax potentially harder and make anything that feels even a little bit softer, like your own partner's body or a toy, feel inadequate, therefore making it harder for you to achieve orgasm in real life partnered scenarios. And in the worst case scenario, your aggressive masturbation technique can result in a penile fracture, a real penile injury. This is rare, but if sufficient force is applied, particularly if the penis is bent or compressed forcefully by either on purpose or by accident, you hit so strong force and is bent, it can cause the corpora cavernosa, the two columns that fill up with blood in your penis, to buckle and fracture, basically causing a rupture in the corpora and blood filling the spaces underneath the penile skin. This, by the way, is a surgical emergency. If you notice significant onset of sharp pain, your erect penis goes down and starts swelling, especially if there's significant bruising, suspect a penile injury or penile fracture. You get yourself to the hospital. If proven to be a fracture, we have to take you back to surgery and repair that rupture in the corpora cavernosa to fix it. Neglecting to fix it soon can potentially lead to long-term issues with performance, erectile function issues. I talk about penile fracture in an earlier video. You can check it out. The link is below for more information. But yes, forceful masturbation can potentially lead to penile fracture injuries. So here's how you fix it. Loosen your grip, vary your speed. Don't always go full throttle every single time, day after day, time after time. Vary your speed, loosen the grip so that you don't put your penis at risk of injury and develop this like death grip syndrome, if you will. Number two, if you always do the exact same thing in the exact same position at the exact same time with the exact same stimuli, your brain and your body start to associate orgasm with only that routine. It only knows this tune. And that can make it hard to enjoy variety or connect during partnered sex. So to fix that, switch it up. Try new angles, try new rhythms, try new settings, try new stimuli. Fix it up, adding variety. Number 3, dry rubbing. Dry is never good. Your genitals are not meant to be stroked dry. Dry rubbing on your genitals will irritate the skin and cause potentially micro tears on the genital skin. The genital skin is even more delicate than the skin on the rest of your body, and it's packed with a lot more nerve endings. So genitals are meant to be lubricated during sexual activity. That includes masturbation. So please remember, lube is your friend. Be kind to those thousands and thousands and thousands of nerves and that delicate skin that you have on your genitals. Really super important. Wet is correct. Dry is not. Use lube, at least use some warm water. Grab that lube, it's your best friend. When you rush through masturbation like it's a dirty secret, you may develop a disconnection. And if you have a lot of shame associated with masturbation, it can actually develop stress and anxiety around sexual activity. We don't want to reinforce negative feelings about your own pleasure. We don't want to inhibit orgasms for the future. So take your time, be mindful. Remember that pleasure is a normal human experience. It's not a punishment. It is not something to be ashamed of and embarrassed. It is normal human sexuality. Let's talk about what good masturbation looks like now that we've gotten a look at what bad masturbation looks like. I'll say it again, said it before, lube is your friend. Lube makes everything smoother, gentler, more pleasurable. It reduces friction, helps avoid irritation, and can make things feel really a lot closer to what real sex feels like. So grab that lube. There are different varieties. I've talked about lube before. You can check that video out, video link below. But make sure that you're not doing it dry. Explore your body and switch up styles. Again, the clitoris or the tip of the penis might be your go-to, but you know what? Try starting with your inner thighs or playing with your nipples or perineal pressure. Try edging, getting close to orgasm, but then backing off before and then easing back in. Try slow strokes, try circles, try squeezing, try tapping. Whatever feels good. You might discover an entirely new orgasm pathway, and exploration leads to better sex everywhere. Use your imagination. Use your brain. Your brain is one of your biggest erogenous zones, believe it or not. You can have mental fantasies. You can use audio. You can use visuals, read erotica. Let the imagination flow. Utilize the tools that we have around us. You can incorporate toys, you can incorporate erotica. You don't have to do solo without support, okay? So use your imagination. The final takeaway is that masturbation isn't just about getting off. It's about learning your body. It's about deepening your pleasure, about building a better relationship with your own sexuality. Research shows that mindful masturbation, meaning present, relaxed, focused, can actually increase orgasm intensity and sexual satisfaction over time, including partnered sex. So, which one of these techniques, good or bad, surprised you the most? Which one of those were you already incorporating? Drop in the comments, no judgment zone, always. And let me know if you had a bad masturbation experience. I kind of want to know that too. But don't forget to like this video, subscribe, and share it with a friend who could use some technique improvement. Like I said, I'll link below references to my earlier videos regarding penile fracture and regarding different types of lubrications and personal lubes. And as always, join me next time for all things down there, right here with me.